Nakitulong ka Ri Khasi. Ngiwan lam siya pi ko sngur bakhuit patpashngem. Ka beats aqua. Si postnem dang yai pinja slang.
Our generation never had influencers. I did know one influencer. It was my dad's right hand.
Been hearing about you a lot, Shillong. On March 27th. Get your tickets so you don't miss out on the laughs. Let's make this special.
Doktor Ghani na Apollo Hospital Chennai unwan Shillong Sien Bnai Bnai jing Sumar bapang Budlum. Habakren shiklap tha Khubor bentaga sngi Doktor ula pensyai bat batai benya halor ka jing day bat ka jing pang shim Budlum. Ulawan hanong ba Shillong ban Sumar gi nong pang hakabai day khamtam barush in Budlum. Ula batai bha Shillong gi nong pang ki badang malumala ki lahi ban Sumar hangni bat di bela khamjor ki hak ban let ban sha Sumar sha Apollo Hospital ka badan hanong ba Chennai khamtam gi nong pang gi ba hak ban poit na marba ha Apollo Chennai labyang lut na dong shadong. Doktor ula batai beniaru yak rukom baki brio ki ban le man gasni hakabai day bak rukom tre rukom bam ban lat na jing pang Budlum. Shushu lo ongru bak jing Sumar yu Budlum ha Apollo Hospital kalong ba paka bat ki brio ki shania. Ulo ongru bak jing khub le kumba khandai % ki ba sha Sumar ki la yo ek jing kod. Doktor Ghani ula ajing kren ya gane mentagasni ha Apollo Trinity Center ka badan halai mkra Shillong.
Hi everybody, I'm Dr. Ghani, Senior Consultant Spine Surgeon from the Apollo Hospital, main hospital in Chennai City. So I have started visiting Apollo Trinity Medical Center in Shillong from the start of this center. Now this is my third visit in Shillong. So we consult patients here who are having issues with spinal problems and any other orthopedic issues. So spine issues in particular, any sort of problems as far as low back pain, neck pain, people who have spinal infections, tumors, and when we say tumors we are talking about cancerous conditions and anything related to spine deformity conditions, like when we say hunchback, like be it kyphosis. When we say kyphosis we talk about hunchback. When we say scoliosis we are talking about spine which is bent out like an S, which happens very common in the children, like in the adolescent age. So in the adolescent age group, people who have an S-shaped spine called as scoliosis. So we treat everything that related to spinal problems. And a lot of people in the old age group, they come up with issues of low back pain, knee pain, neck pain and things like that. That is the age-related osteoporotic changes that can cause these wear and tear in their bones and joints. So we treat that as well. And one other major thing that we have been seeing of late is because people are more into gadgets these days. So the exposure to all these gadgets causes a lot of what I would say is a change in the posture. Okay, so people are into desk jobs. They sit and work in computers for long hours. Sitting and working in computers, they have to sit forward like that, keep looking into their laptops or their desktops for long hours. They end up having neck pain with radiating pain to their arms and legs. And again, people sitting, leading a sedentary lifestyle, okay, sitting for long hours of work, no proper exercise, no proper diet and no proper sleep. All these things together cause a deleterious effect on the spine. So any issues with spine, since I visit once in 2 months, I would be glad to consult and treat all of these patients, okay, who are facing these particular issues. Thank you. So you're talking about injections that they get in the spine.
Yes.
For some sort of surgery, spinal anesthesia you're talking. See, when women, when they undergo cesarean section surgeries, they do have a spinal anesthesia that's happening, right? So not all spinal injections as such do not cause any back pain. The problem is something more to it. So when the tummy increases, okay, so in your lower back or in your spine as such, like on the back side, you have some bony prominence and ligaments which support the spine to maintain the framework better. But in the front part of the spine, you have your tummy. If your tummy is going to get flabby, and then there's going to be a lot of pulling force because of gravity. And that pulling force, no exercise, and when your core muscles are weak, that's when your back pain starts happening. And what happens is many times following pregnancy, people do not do exercises and they leave it off like that, they ignore it, and then the whole abdomen gets flabby, and so it starts building up over time. The pain starts building up. They say then they correlate that with the spinal injection. They say that I had this injection, after that I'm having this pain. It's a very, very small needle that doesn't cause as such any issues. It is the muscle and the bone which starts getting weak because of the lack of exercise and the food pattern. And of course, when I talk about food patterns, like you should avoid the intake of junk foods, fast foods, carbonated beverages, and added sugars, too much of sweets. All these things are a big no. Okay, as not even for spinal health, in general, for as a holistic approach to the health of our body. A balanced diet is always what we'll have to look at. So I come for a day. I come once in 2 months to Shillong to consult patients. I'm there from morning until evening the same day. Okay, and in case if somebody needs an investigation, so what we do is we give them the investigation, and if they are able to get it immediately, it's well and good. But sometimes it doesn't happen that way. And so once the investigations are done, so they will hand it over to the concerned staff here in the Apollo Center, and they email it to me or they WhatsApp me the reports, and I have a look into the reports and I send them a detailed prescription as to what needs to be done further on. If they can be managed with medications, then that prescription they will be following for the next 2 months until my next visit. Suppose they require some sort of surgical intervention, then the staff over here, they will coordinate and they will get them sorted out for a procedure in Apollo Chennai. Okay, certain procedures we can do it here as well. Okay, but those are like small procedures like injections and some sort of daycare things we can try doing it over here. But the major procedures, because you require the whole team, you require the proper anesthesia team, you require a proper ICU care and all those things, and we require to have a post-operative rehabilitation, the physiotherapy, everything makes a lot of difference. So that's the reason it's ideal to come to Apollo Chennai, because we have the state-of-the-art facility over there. So whenever a person is going to, some people who are in desk jobs, let me tell, whenever you sit, I always want them to sit on a high-seated chair. High-seated chair, their lower back, their neck, everything well supported, like those office chairs. Okay, and sit as close as possible to the desk. Okay, what people do is when they work in computer, they sit like this, they forward bend like this, they keep working like this. This is a very, very horrendous posture. So you need to avoid that. This is the whole cause of all the neck pain and back pain they are facing. So sit as close as possible to the desk and rest your elbows on the desk, where your hand ends, you'll have to place the keyboard. Keep the monitor at your eye level and your desk at your, like the desk at your eye level, and then you keep working like this. With this way, see, it's all rested. There's no much of shoulder issues that's going to happen, and there won't be any neck pain that's happening because you're not forward bending like this. You are maintaining the posture of your spine, and your lower back is well maintained. For every 45 minutes to 1 hour that you're going to sit and work, I would want them to get up, walk for 5-10 minutes, do a little bit of stretch and resume their work. Continuous sitting is not advisable. Second thing is, always make it a point to do exercise regularly. Okay, at least in a day, for your own body, you should try to allocate half an hour of time to do a little bit of stretch and strengthening exercises and do a little bit of brisk walking, which will maintain your thing. How do you burn your calories? The food that you eat, how are you going to burn it out? And how are you going to do strength training to improve? I see if your muscle goes weak, there is no proper support for your bone, underlying bones. Okay, so that one thing, because lack of exercise is one major thing. People get so much engrossed in their work that they forget the fact that they'll have to take care of their own body. And one more important thing is sleep. Lack of sleep is one other major issue that I have seen in a lot of patients. Minimum of 6 hours of proper sleep is something which is mandatory, because you will have to allow for muscles to recover. Okay, the brain gets shut down. Okay, so you have to have focus. So many things. 6 to 7 hours of proper sleep is very, very important. Try to reduce gadget usage 2 hours prior to your sleep, because the blue light that it emits causes a lot of alteration in your brain's wave pattern, and so that's something that you'll have to focus about. And so your food is one other important thing. Have a balanced diet, like a kind of you should have protein in every meal that you take. Okay, a lot of fiber, healthy fats, and less of carbs. Okay, so this is something that no carbonated beverages, no sugars, particularly no added sugars. Okay, the sugars from the natural source is a little bit fine, but sweets and all those things is a big no, because you can take it once in a while, but on a regular basis taking that is not at all a solution. So these things if we focus, so exercise, having a proper food, having a proper sleep, your postures during your workplaces, and those things really matter. And people who ride bikes, it's definitely okay to ride bikes, but the main part is the roads are a little bit, those bumpy roads and those potholes, you have to be careful because the jerk that happens, it doesn't happen in one day. It starts building up over time and the wear and tear increases. It's like your bike having a shock absorber and you just literally rip it off, and then that one point of time the shock absorber gets worn out, right? Similar to that, our spine, our body reacts, our bone, the cartilages, the ligaments, everything react the same way. So we'll have to take care of that, and so that 50-60 years down the line, it's not like a very damaged spine or a damaged joint. Things like that. Yeah, so suppose for example, let's start with one condition after the other. Suppose a patient says that I'm having severe low back pain, and they say that my low back pain is started after I tried lifting some weight and things. And initially the pain was only in the back, now the pain is radiating to the legs. If they start saying that, then that's when they'll have to start consulting a spine surgeon and not keep taking up medication just like that, going to the pharmacy and taking some painkiller as such. That's not good. Because the earlier we identify a problem and we treat it, the better is the prognosis. Okay, and see, not all spinal issues require a surgical intervention. So we will be able to treat at least 70% of the cases by a conservative line of treatment with means of medications, by some sort of exercises and some sort of therapy. Okay, the problem happens when we don't diagnose a problem earlier and when it gradually builds up over time and reaches a point wherein, of course, now there is no other option. A lot of people, what happens is they come up after a year, after 2 years, they say, "Sir, doctor, I tried all those things. I tried Ayurveda, I tried homeopathy, I tried other sorts of therapy." See, all modalities of therapies, they help with controlling the pain only to a certain extent, but it does not treat the cause of the problem. So we have to first identify the cause, and then we have to know, okay, because of this cause, the patient is facing a particular symptom. So when we know that, then we will be able to correlate and understand by means of doing some radiological clinical evaluation and know that, okay, this is a problem. This is not a problem which will get sorted out by doing some sort of exercises and medications. So it might require a surgical intervention, and the earlier the better. We talk about a golden period. That golden period is a time where we see the spinal cord is very, very sensitive, the nerves are very sensitive. So, long-standing compressions generally do not recover much better than how it is when it is a freshly diagnosed case. So that is when we'll have to intervene. So my thing is, beyond a week's time, a patient is having an issue and is not at all getting settled with any sort of medications or therapy, ideally they should go and meet a spine surgeon. So this is my third visit to Shillong. During my second visit, I had one of the patients who had a cervical spine problem. So she had been having a lot of pain in the neck and radiating pain to her arms and weakness in her arms. So this patient underwent a significant disc replacement surgery in her neck with such a small incision, like a microsurgery kind of a thing. And she was discharged after a day's time following surgery, and she is all happy. She came today for a review, and she's all good.
So can you tell
Managing osteoporotic spines are very, very challenging because the screws do not have a proper hold in the spine, because the bone is like a papery structure. It becomes like that. It becomes worn out, and the screw doesn't really hold. So we try to manage them by treating the osteoporosis up front over a period of say 6 months, and then we try doing that. And people who have a hunched back, to make them straight, okay, we try to do a procedure. It is an extensive procedure, and sometimes we have to use almost literally 28 to 30 screws in their spine to almost bring back their alignment. People who are looking like that, we want to make them walk straight and make them face like they're always looking to the ground, they can't even look up. So in that condition, how to make them walk straight, so that is also a challenge. We're able to do that, and we've been able to provide good results.
So is spine surgery safe?
Spine surgery is very, very safe, but we need to decide whom to operate and whom not to operate. That is the biggest challenge. Okay, so we can't rush through a procedure and say that, oh no, okay, this is there. I see an MRI and then I end up operating. It doesn't work that way. So we'll have to examine the patient properly, try to understand what the patient wants. Okay. Sometimes a patient might have a significant problem in the MRI, but if you see them clinically, they'll all be fine. So those are patients that we shouldn't touch. Okay, because you might end up doing a very good surgery, but after that they will be saying that like doctor, I was like fine all now after the surgery and like this. So that's the whole issue. So you need to understand clinically, correlate the symptoms with the radiological diagnosis that you are achieving, and then when you have a sure shot, then you know at least 50 to 70% if you know that okay, this patient mandatory requires surgery, and that's when you proceed into it. Today we are moving towards the usage of a lot of robotic rehabilitations in spine surgery. Okay, and people who have been paralyzed and who are trying to recover, the robotic rehab has also been really helpful.
So like
A big robotic system over there, like we have been using it, and it has been really helpful.
how is the feedback of the people?
Yeah, it's very good. It's very good. Like we have, by God's grace, we have had more than a 95% success rate, I would say. So it's and then we are progressing and we are trying to move to the next generation of robotic machines, and then like to see how we can advance further in whatever field we have been doing so far. We are one center where we are able to provide almost nil infection control protocols. Okay, so the post-surgery infections, everything is like managed in a very meticulous fashion. That is one thing. And again, as I mentioned, we have all, you name it, we have it. Okay, so all those things are there, and everything under one roof makes it easier. And if and cross reference, suppose a patient is having any other medical problems, be it heart, lung, kidney, liver, and any other issues, so we are able to evaluate it properly before we proceed with a surgical management. And even post-operative intensive care, everything is all well organized. So that way each department has n number of specialists, and if one person is not there, the other person is there to take care of the thing 24/7. It is working on the clock, and so I think that is what we require under one roof. It's not just about doing that surgery at that particular point of time and then leaving it off and okay, showing hands up. No, it doesn't work that way. Yeah. That's about it.